Hello and welcome to C-Suite Middle East. I'm your host, Shane Phillips, and today we were with Dr. Hayder Zubaidy, the Chief Executive Officer of Nation Hospital. Prior to this post, he was the CEO of Canadian Specialist Hospital, and he has a Master's in Healthcare Management from the Royal College of Surgeons in Ireland. Prior to that, he got his medical qualifications in Iraq, where he managed several hospitals before coming to the GCC. Dr. Hayder, thanks for having us on the show.
Thank you, sir.
When we look at managing a hospital, it's very complex, so many different departments. What are the key metrics that a CEO should be looking at to drive peak performance within a hospital?
It goes without saying that there are too many of these. We look at the hospital from many aspects, but as an example, we can mention some of them. Of course, patient safety is one of the most important, and this is checked by accreditation and checked by having and achieved by having a qualified department and being prioritized. Patient safety is one of them. The second is patient satisfaction. We measure the success of the hospital as per patient satisfaction. The third one could be the staff satisfaction, because the staff is one of our main stakeholders. One of the most important aspects, just to ensure sustainability, is the profitability. As an example, sometimes we measure number of visits, number of free visits. There are hundreds of those.
Let's talk about profitability. How do you manage it? How do you maximize it? What's your approach to it?
That's a bit complicated question, because it's different from country to country. It's different from emirate to emirate. It's different within the same emirate, but two different hospitals. As an example, the pricing structure of the healthcare services in Dubai is not the same in Abu Dhabi. Abu Dhabi is using DRG, and in Dubai it's different. So it's very difficult. But we usually, what is common between them, the profitability, the profit and loss report at the end of the year, where we check the profitability of the hospital. Then we go into departments to check the profitability of the department. Then we go a bit more in depth, start checking the doctor's performance themselves. This will give you an indication about the work of the hospital. Not always the loss or the profit is made because of the doctor or because of the staff. Sometimes it's because of the nature of the service provided, the structure of the pricing. Sometimes you have to price below the cost simply because it's market-driven. It's market-driven prices. So you should be somehow flexible and keep close monitoring into this, especially with your stakeholders. One of your stakeholders are the insurance companies, who is part of the whole process. So usually it's difficult to identify unless you go into details.
Well, thank you for shedding some light into this area, and hopefully we look forward to talking to you again soon.
Thank you, sir.